Well, the nation continues to reopen, and right here in Florida and Georgia, restrictions continue to loosen, but the number of COVID cases still continues to rise.
Dr. Christie Alexander with FSU's College of Medicine joining us live again today to answer more of our questions. Dr. Alexander, welcome back and thanks for being with us.
Yes, thank you for having me yet again.
All right, well, it is advised by the CDC that everyone wear a mask in public. We see yours in your hand there. This question going around on social media, if you are wearing a mask, does that mean you don't have to socially distance?
No, that's not what it means, unfortunately. They go hand in hand. So social distancing of that 6 feet is equally as important as wearing your mask, and wearing your mask at all times, because even if you're outside and somebody sneezes or coughs and the wind catches it just right, it may be more than 6 feet that you need to be distanced, and if you're not, the mask is there to protect you. Also, in some of those places where it's very hard to maintain 6 feet of distance, or you're unexpectedly coming up on someone who's closer than that, the mask protects you then as well. So it's just as important to wear your mask while you're socially distancing, and I really encourage everyone to continue doing so.
We've reported throughout this week that school districts and really the state of Florida looking as to what it might look like as far as the fall is concerned, what reopening could look like. One Florida medical professional raised questions this week about reopening schools too soon. What is she concerned about?
Well, there's a lot of concern about children being in close contact again, because as you can imagine, just like with the common cold that spreads so rapidly through schools, COVID-19 would do the exact same thing, and we're not exactly sure if it's going to still be with us by the time the school starts. So the concern is that if we open too soon, not only will kids give it to each other and get sick, but they might be bringing it home to family members who would get sick as well and could suffer really, really intense damage from getting sick with COVID-19. So the concern is real. It makes sense to be this concerned, and just know that there are public school officials, doctors, everyone getting together to discuss this issue and to decide what to do as things roll out. We really won't know until 30, 60, it's just a day-to-day thing to see how many cases are evolving as time goes on. So it remains to be seen what we do at the schools at this point.
And from the start of the pandemic, we've been talking about the virus spreading from surfaces. Evidence shows it can live on many things for 24 hours or more, but now the CDC is adjusting its messaging on that. What's the latest that we're learning now?
So we still know that the virus can live on cardboard for 24 hours and plastic and steel surfaces for up to 3 days. But what we're not seeing as much of is people catching the virus from surfaces. Where we're seeing it more is that contact with somebody who's infected with the virus, whether they're symptomatic or asymptomatic. So because of that, that's why they're not saying that you absolutely can't get it from a surface. We're just not seeing it in the numbers that we are from human to human contact. So it's a little bit of a change, but not that much of a change. It's just, where are we seeing those cases? It's mostly when people are close together, more so than touching a box that you bring in from the FedEx man.
There's new research comparing COVID-19 with the flu in patients who've died. What can you tell us about those findings?
That's a great question. It's very interesting, actually. So what we have, this is all done on post-mortem, unfortunately, the studies that have been done, but what they've seen is that in COVID-19 patients, the large blood vessels to the lungs are equally have as many clots as they do with flu. The difference is the tiny capillaries have 9 times the amount of microclots with COVID-19 than with the flu. So in those tiny capillaries, that's where oxygen and carbon dioxide are exchanged. And if they're clotted, the exchange can't happen. So that's why we're seeing lower oxygenation levels in patients with COVID-19 well before they're just short of breath. They could be talking to you and have lower oxygen levels, and we're thinking it's because of those microclots that occur. And all of that has to do with inflammation. So it's kind of what we've talked about all along, that this is an extreme inflammatory response that our bodies are having to this virus, and it's such a new virus, our bodies don't know how to handle it. Now, the good news is the other thing that they saw was new vessels. So not only did they see a lot of microclots, but they also saw the formation of new blood vessels to the lungs. And we're thinking that that's the body's way of compensating for those clots. So those that survive it, they may be forming new vessels faster than they're clotting, and that could be a good thing in determining how people are getting past the virus. At the end of the day though, the bottom line is more research needs to be done. We keep saying that over and over again. It sounds like, wow, this is a lot, but more research needs to be done to firmly decide what's happening with the body.
Okay, and it is a holiday weekend. We know lots of people undoubtedly are going to make plans to maybe head out to the water or get together with other people. What is the one thing that you would really stress for people if they are going to be in close proximity to others this weekend?
To not be in close proximity? The one thing I would deeply stress is to continue that 6 feet of social distancing and continue to wear your mask. That's it. And throughout the time that if you are going to be out, making sure you're practicing good hand washing throughout that time as well. As you touch things, you just don't know. Again, we don't think it's coming from surfaces, but just to be on the safe side, make sure you are practicing good hand hygiene and make sure that you're maintaining that 6 feet of social distance and maintaining your mask.
All right, Dr. Alexander, is there anything that you would like to add before we let you go for the weekend?
Yes, I would like to wish all of our veterans a very, very happy Memorial Day. We've been talking a lot about healthcare heroes over these past few months, but they are the heroes this weekend. And without them, we would not be the land of the free. So I thank you all so much for everything that you've done, and I wish everyone out there a very happy Memorial Day.
All right, Dr. Alexander, thanks so much, and we'll see you next week.
And as always, you can rewatch this interview and all of our previous ones with the good doctor online at WCTV.tv.